Hi everyone, welcome to our DDH info session about the Pavlik harness treatment. And I thank you all for coming today. Before we get started, I would like to acknowledge that our lab and BC Children's Hospital operates on the traditional, unceded, and ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh nations, and we are grateful for this land and its caretakers. And today, our agenda will give you some time to learn about the Pavlik harness, the care of children in Pavlik harness, and then we'll have a question and a period with our panelists. And moving on. So I'd like to introduce our first panelist today. Alyssa Robinson is a nurse practitioner in the Hippy lab. She completed her NP degree at UBC in 2022, and she works as part of our team in order to provide the best care for our patients in the clinic. She has worked in both the emergency department and the orthopedic clinic at BC Children's Hospital, and she was drawn to orthopedics because it combines medicine with functionality. Thank you for joining us today, Alyssa. And next, we have Dr. Hayley Spurr, an orthopedic surgeon. Dr. Spurr is a Vancouver native, and she completed most of her education abroad before returning home for further training and building her practice. She completed 2 years of fellowship at BC Children's doing pediatric orthopedics, and she's now developing her practice in the Fraser Health Authority, based mainly at Royal Columbian Hospital and Surrey Memorial Hospital. A large focus of her practice is hip dysplasia, and she actually runs the baby clinic in the Fraser Health Authority. And thank you for joining us today, Dr. Hayley Spurr, and I'll hand it over to you now.
Awesome. Thanks so much, Denisha, both for hosting the night and also for introductions here. We're both so grateful to be here. And hopefully we can provide a little bit of an insight into what it's like to apply a Pavlik harness and to wear it. So we just wanted to take a moment to give an important disclaimer that due to the complexities of individual patient care, we're not able to answer any specific medical advice if anyone has patient-specific questions. And really, personalized medical guidance requires a thorough evaluation by a qualified healthcare provider who can focus for each person's child's unique needs. So this will be a much more sort of general thing. And of course, there's exceptions to every rule, but given that the Pavlik harness is such a common thing, most of these things are applicable to all of the children that we treat. So just to get started, what is developmental dysplasia of the hip? So you can see from our image, it's a bit of a spectrum, but DDH encompasses a range of hip joint abnormalities from mild instability all the way to dislocation at birth. And our bones develop over time from soft cartilage. So the hip joint is particularly underdeveloped at birth, and DDH is where a baby has a hip joint that might be a little bit loose, so that ball and socket joint, the ball moves around too much in the socket or inside the cup. And sometimes it can be completely outside of the socket, which means that the hip is dislocated. So untreated DDH in infancy can cause children to later develop arthritis in the hip joint at a young age and require a hip replacement. So our focus on screening is to diagnose DDH as early as possible and try to avoid the need for surgical intervention. So from our standpoint, earlier diagnosis means more effective treatment. So I titled this slide, "What's DDH?" You might find that your practitioner frequently interchanges these terms, developmental dysplasia of the hip, DDH. It's a very common short form. And then this picture is probably the most common graphic that's in academic hip dysplasia presentations because it really demonstrates that there is an art to treating hip dysplasia and a huge amount of variability. So there's a range of severity, which means that everyone's journey looks a little bit different. So you can't compare all children to each other, especially if you find yourself in a sort of parents group. Everyone's situation is just a little bit different. So ultimately, our goal is the same, that we're trying to reduce the hip joint. If your hip is not dislocated, then we're trying to improve the stability. And our whole goal is to guide it through development.
So thank you, Dr. Spurr. So we're just going to go on to the risk factors. So developmental dysplasia of the hip or DDH, I think there's a good understanding of the strong risk factors There's still a little bit more work that's ongoing about the exact cause of it, but we know that these are really strong risk factors for developing it. So the first one, and probably one of the strongest, is family history. Often we say if you don't necessarily know the word DDH, then it's unlikely to be in your family. But there are a few things that sometimes I find people know about and they don't actually make the connection. So for example, things where parents were double diapered or triple diapered, that actually could have potentially been a hip dysplasia because that was once kind of thought to be the treatment for it. Or alternatively, family members that may have needed total hip replacements really early on. So that's talking about like adolescenthood or in the 20s. So if you have any of those things in your family, do bring it up with us. There are certainly a large variety of reasons why someone gets a hip replacement early on, but one of them could be hip dysplasia, and we can kind of help you figure that out. So that's one of the big risk factors. The second one is being breech. So that's that bum down position. There's also thought that being kind of a bit more horizontal or transverse can slightly increase your risk, but it really is that bum down breech position. Being firstborn and being female also do slightly increase your risk as well. And then the last one is hip swaddling. And when we talk about hip swaddling, we talk about, really tightly bound legs. I think a lot of people have questions about sleep sacks, and about that sort of swaddling piece. But as long as the hips are freely moving, that's not really the swaddling we're talking about. On the next slide, we'll go over what that will look like. So this is what we're referring to when we talk about kind of unsafe or, incorrect swaddling technique. So on the right-hand side, you can see that the hips are kind of tightly confined, excuse me, and they're tightly wrapped around. And that's just more likely to cause that hip joint. You can see the arrow there just kind of going a little bit more on the outside. Whereas if you can look at that correct hip healthy swaddling technique, it really does allow those hips to freely move around rather than tightly swaddling. And there is a really great video that's on the I'm a Hippy website that kind of shows this technique and how to do it.
So why have we chosen to talk about the Pavlik harness? As I'm sure many of you are aware, there's different treatment options for hip dysplasia, and they really vary from degree of invasiveness. So our aim is to be able to do brace treatments and avoid a surgery. But there are, depending on your specific presentation and treating institution and the age of presentation, may be finding yourself needing surgical intervention as that first line of treatment. So just to briefly talk about some of the surgical interventions, it's a bit of a graduated or a la carte surgery where depending on your child, you might need a different thing. So when we talk about a closed reduction or an open reduction, that's a surgery so that we can take that hip that's dislocated and put it back in joint. And closed means that we do it predominantly without any incisions. We do release one tendon, but there's not any big scars. And we basically put your child to sleep in the operating room and manipulate the hip so that it's back in joint. Then they go into a spica cast, which mimics the position that these brace treatments are, but they're in that cast for a prolonged period of time, often around 4 months. Open reduction, very similar to closed reduction, is all about getting the hip joint back into the socket. So taking that femoral head and putting it in. But we need to do a big incision and directly release the structures that are blocking the head from being inside the hip. Some of the images on the right, you can see plates and screws in there and different pins. And often these surgeries are associated with different surgeries to cut the bones and reorient them. So either on the femur side or on the pelvis side. But that's a little bit nuanced. We wanted to focus today on the brace treatment. So within the braces, there's 2 typical braces. We talk about a fixed abduction brace, which is the image on the lower part of the screen, that blue and white Rhino Cruiser. And it's just a little bit more rigid and holds the child in a much more structured position. And then the Pavlik harness, which is our focus today, is this soft brace, and it is a dynamic brace.
So what is the role of the Pavlik harness? Why exactly are we putting this on and what are we expecting it to do? So what it does is it really helps to maintain the position of the hips in a safe position, which really allows kind of the joint to develop in a way that we'd like it to. And we've included a nice photo there, which shows you when their legs are in that kind of froggy leg or M position, what that looks like kind of from a bony level. But what it looks like is that traditionally that head of the thigh bone is sitting nicely in the hip socket. And so that allows the bone as it's growing to maintain this position. So that's kind of the goal of using the Pavlik harness.
Yeah, and some of the more specifics of the Pavlik harness itself. So this is a soft brace, as I mentioned, with adjustable straps. So there's some standard sizes, and then we can adjust it to fit your child specifically. And so the soft nature of the brace often makes parents more comfortable sort of holding the child. And the cool thing about having a soft brace is it's actually what makes it a dynamic brace, as I mentioned. So while this brace holds the hip in a position to allow it to develop, the child can still move within the brace. So in fact, we're looking to see those legs kicking. And really the way that I would describe the brace is that it restricts you from going into the extreme positions of your hip. So it's just keeping them in that position where it's helping to stimulate development by pointing the hip right at the part that stimulates growth within the body itself. So typically this is for babies who are under about 6 months of age, but really depends on size. So we just want to make sure that the child or the patient's not going to be able to overpower the brace. And so sometimes you might find you being offered a Pavlik, and then partway through we might have to switch the type of brace, or when we put the harness on onto the patient, we realize that they're just too powerful and that the brace is not preventing them from going into that extreme position. The duration itself can be variable. As we mentioned, it's quite patient specific, but I'd say sort of a general range is anywhere from 6 to 20 weeks of treatment within the harness.
So you've been told you need a Pavlik harness. Now what? So this kind of focuses on that journey afterwards. So the first thing you need to do is just take a breath. And I think too, like just taking a step back, prepare your schedule with these harnesses or braces. You will have frequent visits and be really well supported. And a part of the reason why we do frequent visits is one, we recognize it can be a very overwhelming time. So we want to be there to support you. And then the other reason is that these harnesses do require a degree of adjustment as your baby's growing, because as we all know, babies grow quite quickly. And so we need to adjust the harness to fit their growth schedule. So sometimes that might look like weekly visits, and sometimes that might look like every 2 to 3 weeks, depending on your child and their needs, but your provider will outline that for you. And then we try and remember this, but really important to always remember your care team to try and weigh the baby and weigh the harness, especially in that really vital growth period. It can be really challenging to weigh them with the harness on and not really get a good sense of how much they weigh. So weighing them in the clinic without the harness on and knowing the weight of the harness can be very helpful to accurately track your child's weight gain, which as we know is very important in those first few months. So clothing, we know it's really challenging because you've likely spent, the whole time you've been pregnant gathering really cute onesies and outfits. And so we recognize this kind of puts a little bit of a wrench in things. But ultimately we recommend that this harness is directly against the skin for the most part. So this doesn't mean you can't have anything over top, but loose fitting dresses in the summer are a really great option, or sleep sacks tend to be a great option in the winter time. But ultimately just no restrictive clothing over the harness. So nothing like pants. Pants really do pull the legs in and kind of counteract that kind of froggy leg or hip abducted position that we like. So ultimately nice and loose fitting dresses during the summer, and then sleep sacks during the winter time is kind of a good rule of thumb.
So what about the cost of the Pavlik harness? We kind of wanted to put this in to discuss that it can be quite variable depending on the site that you're at. And certain sites, the hospital itself charge sort of a materials cost. So sometimes that raw cost might actually be, in the range of being around $100, and it's usually billed by the hospital directly. So I think it's important to note that sometimes there is a fixed cost that's actually associated with the brace. Sometimes parents opt to buy two just because it makes it easier for them. But in that initial period when you cannot remove the brace, there's no reason to have more than one. And then we also just wanted to highlight some of the indirect costs. Oftentimes there is a parent who's on paternal leave during this time, but it could be that if you're working, there is a parental loss of income so that you can bring your child to clinic for these visits. And as we mentioned, there's going to be a few kind of close together at the beginning, and then just the cost of actually coming to the appointments. So we just wanted to recognize that we are aware that there is sort of indirect costs associated with it, but you're going to be very well supported throughout this journey. And really it is important to have these meeting points.
So the daily use. So what is this going to look like at home? How are you going to use this? So a lot of the frequent questions we get are, if they're in this like 24 hours a day, how am I going to bathe them? So it really is a sponge bathing type technique. And that's literally just getting a washcloth with some soap and water, and just always mild soap with no scent. Getting up and underneath the harness there, and then just kind of patting to dry with a towel. And then one of the big things too, we're asked is, how do you clean the harness? Like, as we all know, babies spit up. They can get the harness quite dirty. So really wearing bibs can help prevent soiling. But we will go through kind of how to clean that if it does happen, because it inevitably will. And then tummy time. So tummy time, as we know, is really important for a child's development. So you can certainly still do supervised tummy time. That's really great for helping those core muscles and those muscles that support the hip develop. Just be mindful, you might need to place a roll under the shoulders, or I like to start with the baby on the chest and just kind of graduate them slowly to the floor, because there is a degree of getting used to the mechanics of that harness there. And then breastfeeding. We do know that sometimes breastfeeding in and of itself is a bit of an adjustment for some people, and we recognize that this can present challenges. But ultimately, it's a bit of trial and error. You need to try a variety of different positions to see what works best for you. A lot of people report like a football hold or a chest hold is most successful for them. But again, it's not a one size fits all. You do have to be willing to kind of trial and error lots of different positions, and your care team can also help you and connect you with resources that can support that. Another one is laying on the bed with the child next to you and having them turn their head. Sometimes that can be a helpful one if you're not able to hold them. And then also C-shaped nursing pillows can be very helpful as well to support breastfeeding.
So as Alyssa mentioned, we said we'd touch on cleaning, and I certainly think this is the biggest complaint that I get in clinic is, oh my gosh, like I can't clean it now. It's already messy. And so spot cleaning is really the crux of how we clean it. I've actually had parents tell me that they have a dedicated toothbrush that they use. So they'll put a bit of detergent on the toothbrush and then spot clean it around. And I find that the two areas that end up the most dirty is sometimes it's the chest strap, but really when the baby spit up and they're on the shoulder straps here. And then obviously if there's any sort of blowout from a diaper perspective at the back. So those are the two kind of major places I find people are spot cleaning. And so if you use a spot cleaning technique, and then you can dry it on low heat. Some people talk about using a hair dryer with no heat on, just so that it's not wet and against the child's skin, because that can cause issues in itself. And so we kind of talk about that being the best practice. Only if your healthcare provider tells you to use a washing machine do we recommend it. It definitely needs to be on a delicate cycle if you're going to do that, because any sort of that spinning cycle really causes the structure of the Pavlik to be lost. So when we go through how to put the Pavlik harness on and off, we're trying to minimize adjusting as many straps as possible. And it's not uncommon if we see them in a spin cycle within the washing machine, and especially within the dryer, that they basically all of that Velcro just balls up together, and it becomes very challenging for you to adjust it afterwards. So if your care team is willing to let you use a washing machine, you just need to make sure we're really on those gentle cycles. And if there's a dryer, certainly no heat to be involved with that. But as I mentioned, that spot cleaning with a toothbrush, I've been told, is the best method.
So daily use. So what can you expect in terms of how you're going to use it and when you're going to use it? So the wear time is really going to be variable, and this is going to be decided with your provider. Sometimes we opt to wear it 24 hours a day. So what that looks like is they're really in it the whole time. You don't take it off. And there will be a variety of reasons why they opt to do this, of which they will go over with you. And then sometimes your provider might allow 1 or 2 hours out of the harness per day. And that could be for bathing, that could be for skin to skin time, for a variety of different reasons. You can really choose how to use that timing out of the harness. And like Hayley said, or Dr. Spurr said, that is one of the opportunities that you can clean it as well when they're kind of having that time out of their harness there.
So car seat safety, we get this question all the time, and I've really put it as the most important on that bottom line there. Car seat safety is your priority. So, you know, obviously as clinicians, we want to focus on your hips, but you need to make sure that you keep your baby safe all in between that. And so really the principles of car seat safety that you are taught at the beginning, you continue with those. Sometimes people talk about having a wider car seat to help accommodate the appropriate position, because as we mentioned, it's important to avoid having them in that forced position where, when the same as swaddling, when the legs are forced together, it just puts them at a bit of a more extreme position that we're trying to avoid in the brace. But most car seats do kind of push those hips together, or at least support them. So we try to avoid prolonged periods of time where this happens. So long car trips, what we recommend is that you take a break. So if you know you're going on a long car trip, every couple of hours, you just bring the baby out of the car seat, you stop. Honestly, you have a newborn baby, you're probably taking frequent stops anyway, but making sure that you come out to allow it to return to the position of sort of safety. And we'll demonstrate that in a second. But as I mentioned, ensuring that those car seat straps are as secure as they would be if the harness isn't there is really the goal and the priority. So we put this picture in just to sort of demonstrate that this is where your child's hips sort of end up, and these straps are preventing them from going into the extreme positions. This sort of relaxed position is where they spend most of their time. And when you put them in a car seat, it really supports the legs back to the middle there, which brings it back to a bit more of an extreme position. So we don't want to have them in that position for a prolonged period of time. And actually, this principle sort of applies to anything at home. We don't want you to just sit there and support the legs when they're in the harness because it defeats the purpose a little bit. But the harness prevents them from going into those extreme positions. And so taking frequent breaks on long trips is important. And then if you know you're somebody who's going to be going on lots of long car trips, that's when you can think about getting a car seat that might accommodate a little bit better.
So what is the purpose of each of these straps that we have? I always tell parents it looks a lot more intimidating than it actually is. It takes a heck of a lot of straps and Velcro just to make two big straps do their job. So the first one is the flexion strap, and those are those two straps in the middle there, or the front that you can see on the front of the baby. So what these straps do is they really do allow stabilization and promote proper development. They ultimately prevent extension, which are like knee extension. So that's where the legs are going to be straight out. And this can actually increase dysplasia development. So that's kind of what the flexion strap is meant for. And then if you look on that picture on the right-hand side or the back of the baby, that's called your abduction strap. So basically abduction is just where the legs are apart. So that's that froggy leg position that we often reference. And this just really prevents your baby from moving their hips toward the midline. And again, abduction really promotes proper positioning of the head of the femur or the femoral head in order to develop how we essentially would like it to. Yeah, so we'll go on to the next one.
So this is probably one of our more complex and busy slides, and it's really probably better used as a reference. Your clinician is going to help go through how to take this harness on and off. But I really liked this picture on the right that had the straps labeled because it's a good reference to go back to after the fact. And while there are different brands of harnesses, really all of the harnesses have these same straps. And so even though this is a black and white picture, all the straps are going to be the same depending on whichever harness you have. So I like to generally think about this as your baby when you're taking them in and out for their period of time out. They're going to come out of the middle of the harness. So basically, we're only undoing the straps that we need to kind of create a bit of a gap in the middle so that your baby can come out of the center of the harness. And then same thing when they go back in, they're going to go back in through the center, and then you're going to resecure the straps as they're required. So taking the harness off, you're going to start by laying your baby on their back. And you're going to take their feet out of the foot straps. So down at the bottom there, the two straps that are on the shin bone, you can see 5 and 6. So 5 and 6 just reference to the opposite sides. And these are two Velcro straps that when they undo, the stirrup at the bottom, they'll be open at the back. And so those two open portions will be faced towards the center or midline of your baby. And then you come up to the top, you undo the chest band and you undo the shoulder straps. So that main Velcro right in the center is undone first. And then the two shoulder straps come undone. And you'll be able to bring your baby out the center of the harness quite easily. It means you don't have to kind of manipulate any of the joints to get them out. And then you can have your time out, spot clean as you need, enjoy your sort of skin to skin time, bath time for baby. And then when it's time to go back in, we're basically, we're just reversing those steps. So I like to lay the harness back on the ground. I always use the sentence X marks the spot. So you can see on the picture on the right that those shoulder straps create an X. And so when you're putting your baby back down into the harness is laid out. You can see the X on the sort of bed as you're going. And that's right where you're going to place your baby so that their chest strap is sitting there at midline. And you're going to basically reverse your steps. So that harness is stretched out, your baby's back flat on their back, You're going to start by attaching the chest piece, which is right around the nipple line. And then you can attach and secure, tighten the shoulder straps so that that chest piece sits where we expect it to. If those are too loose, that main chest strap sort of starts creeping downwards, then you're going to find that every other strap is no longer in the correct position. And so having that chest strap really set at the nipple line is important when you're placing the baby back on. I often say take a picture before you take the harness off so you know what level it's supposed to be at. And then once the chest and shoulder straps are attached back to the markers, then you can put the feet back into the foot straps and put those two number 5 and 6 straps back on.
So here we'll go into, what are some of the risks associated with this harness. For the most part, in general, this harness is relatively safe. And these are kind of the two big ones that we will educate about, mostly because they're pretty easy to identify. And if they're easy to identify, then we can hopefully counteract them as soon as possible. So the femoral nerve palsy, it's basically just a very fancy way of saying that nerve's fallen asleep. I always equate it or kind of make similarities to when you're sleeping and you fall asleep on your arm. It's this similar sort of idea. So that nerve falls asleep, and it occurs when there's too much pressure put on the nerve at that hip joint. What you will outwardly see, or what you will see your baby do, is they will decrease or they won't kick one or both legs. So if you see, or even if you're questioning it, and I always tell my families, even if you're not sure and you just have a gut feeling that they're kicking a lot less or not at all, just take it off, and you can help, the healthcare team can kind of help you to make the decision about, do we need to take a break or can we keep going? You don't need to be responsible for that decision. That can be put back on your healthcare team. So I always say, when in doubt, just remove the brace and then let your healthcare team know so that they can promptly reassess. And then skin irritation is another one of the big ones. And that's just due to rubbing of the harness on the skin. So as you can imagine, Velcro and kind of some felt material sometimes can be irritating on gentle baby skin. So just making sure you're doing skin checks as often as you can. A good time to do this is if you are coming out of the harness, checking kind of before and after. And then if you're in it 24 hours, helpful to do it with diaper changes. Common sites that we educate people to check often are behind the knees, in that groin area, around the shoulders, and then the legs as well.
And I think specifically the skin irritation, parents often think, oh, I'll just loosen it and there'll be less irritation. But actually, as you loosen the harness, there's more movement, which causes more skin irritation. So loosening the harness more than recommended actually tends to cause more skin irritation, just because no longer are the straps sitting in the correct position, and there's just a lot more mobility within it. So you've completed your treatment. Now what? These are some sort of frequently asked questions once we've completed treatment, and about the position of the baby. So you'll notice that even when you're coming out for that hour, you'll think, oh, what the heck? Like, my baby still sits in this position as if they're still in the harness. And that's exactly what we want, actually. We're grateful that they're sitting in that position of safety. And so what's important is when they're out of the harness, let them move freely and try and avoid forcing those legs together. And so it's the same thing. We want to avoid swaddling once we've completed treatment, because once again, you're just bringing those hips back to the extreme positions and avoiding sling carriers. So what we love are, the carriers where the legs are separated, the legs sit in those M positions, very similar to the position that they're in the harness. And so we want to avoid positions that have the baby's knees come together. And it's okay that their resting position is similar to this. They will grow out of that over time. But we really want to avoid any sort of like forcing movement to put the legs back together. This is temporary, and don't worry about it. We do afterwards want to avoid sort of baby bouncers and those like exercisers. We usually avoid those for sort of 4 to 6 months afterwards, just because they can often put the hips back into that extreme position when they're trying to reach for the ground. And it just puts a bit of extra strain on the joints. And so afterwards, we just want to get them to continue with their milestones and let them do their own thing. And then over time, they'll gradually return to what you might consider a more natural position.
So what is the follow-up going to look like? So as we kind of alluded to throughout this whole presentation, is that DDH is developmental in nature. So it's in the name, developmental dysplasia of the hip. And what that means is that it can develop. So what I always tell people is, even at the end of the brace treatment or the harness treatment, we've got a normal looking ultrasound and we review that with you. You might be thinking, why do I have to keep following up with your team? And the reason for that is for that reason. It is developmental in nature. And so these follow-ups will include x-rays and then traditionally a physical exam as well. And what we're looking for is we're looking to make sure that that hip socket is developing in a manner that we would like it to. The schedule for this is variable, and your healthcare team will talk to you about what that will look like. But you can expect to be seen until the bones have completed development. And I always like to tell my families, once you're done with the harness, there is a chance, because it is developmental, if we do identify dysplasia later on as your baby is growing, we might offer a different brace. And typically it's different for every institution, but typically it would be that more of that rigid brace that Dr. Spurr was reviewing at the beginning there. And that's more so because they are a little bit older. So a more rigid brace is a little bit more helpful for development at that point. But take home point is that it is developmental in nature, and that's why the follow-up is so important. And that follow-up schedule will be outlined by your healthcare team. So we'll open it up to question and answer period now. Looking forward to hearing what's out there.
And I think we'll stop the recording just to make sure that people feel comfortable to ask their questions, and also to make sure we're not really sort of covering any patient information. So hopefully this was a useful whirlwind tour of the Pavlik harness.
So thank you everyone for a really productive Q&A session. And if you're interested in learning more about orthotic treatments like the Pavlik harness and also caregiver experiences with the DDH care journey, on the screen, if you scan these QR codes, there are 2 studies our team has done on these topics. And as well, if you go to hippylab.ca, you're able to access these studies as well as other information about DDH that our lab has done. And I also want to share that a recording of this session will be available on our lab website, hippylab.ca, after today's session. And as well, we have some more resources for you. There is a nonprofit organization based in BC called I'm a Hippy, and they have great resources, including videos about both Pavlik harness and other treatments for DDH, and just more general information about DDH care and the journey and parent and patient experiences. And you can check them out on imahippy.org. And as I mentioned previously, our lab website, hippylab.ca, also has some resources for you. And if you have any further questions, please contact us through our website. We have a contact button near the bottom right-hand screen of our website. And we'd like to thank our supporters who make events like this possible: the Peterson Group, Michael Smith Health BC, the Monday Family, and I'm a Hippy. And thank you so much to our lovely speakers, Dr. Hayley Spurr and Alyssa, for joining us today. It was really insightful to learn from you, and we really appreciate your time. Thank you all. And like I said before, this session will be available on our website for you to refer to in your spare time. Thank you for coming.